NewTek Orthopedics presents the non-bridging external wrist fixator and the first assistant wrist reduction device. This animation illustrates a patient presenting with a C2 fracture of the distal radius. First, we secure the hand and forearm to the first assistant wrist reduction device. Capture the base of the thumb with the lift arm positioned under the fracture. The fracture is reduced by ligamentotaxis. Lock the first assistant wrist reduction device frame. Adjust the lift arm to correct the volar tilt. Place the NBX fixator body over the fracture over the dorsal aspect of the wrist. Secure the first pin at the ulnar styloid corner. Ensure that the arm of the fixator body is parallel with the forearm. Secure the radial styloid with the second K-wire. Place pins into the remaining fracture fragments. The pin tips barely penetrate the volar cortex. Raise the NBX fixator body 1/2 to 3/4 inches above the skin. Tighten the locking screws alternately to secure all the K-wires to the fixator body. Slide the side clamp onto the radial side of the fixator. Identify and avoid the radial nerve. Place radial K-wires to capture the multiple fracture fragments. Secure the radial K-wires with pin clamps. Secure the pin clamps to the side clamp. Secure the side clamp to the NBX fixator body. Place the first 3 mm half pin in the proximal slot on the NBX fixator body. The 3 mm pin penetrates the volar cortex by 1 screw thread. Distract the fracture to length using the distraction device. Secure the distraction by placing the second 3 mm half pin and locking it in place. Remove the distraction device and secure the proximal half pin. Cut the dorsal pins and apply the cover. There is free volar and dorsal flexion, free finger flexion and extension, free radial and ulnar deviation, free pronation and supination. There is movement at the wrist joint, but not at the fracture site.